So we'll just be a couple minutes before we get going, and we'll let everybody just filter through, okay? So for those of you who are here, thanks for being here with us. Hi, everyone. We're just going to wait for a couple minutes to get everybody started. We'll start in just 2 or 3 minutes. Thanks for joining us. All right, so we'll get started. Ryan, you can hear me?
Yep, absolutely.
Okay, awesome. So I wanted to say thank you for joining us today. It's been an awesome week of webinars. So we call this our webinar week at Care because each of our practitioners with different expertise were able to do a webinar each day of the week. So we talked about 5 easy ways to change your home office. And the ergonomics on Monday. We talked about carpal tunnel on Tuesday. We spoke about low back pain and sciatic pain on Wednesday, and hip pain and also hip pain during pregnancy yesterday. It's been a successful week, and if you'd like to receive any of those webinars or have a chance to view them, you can give us a quick shout and we'll be able to send those over to you, and we'll give you the contact information at the end of this presentation. So today I'd like to introduce our panelist, Ryan Plumpton. He is an award-winning RMT at Care, and we are so lucky to have him. He's been voted in by different patients for the last several years as favorite RMT. So congratulations on that, Ryan.
Thank you.
Ryan is a huge asset to our team. He's been with us for several years, and I quote him in saying this when he says, he thinks of himself as a Swiss Army knife of what was it? Sorry, Ryan?
The Swiss Army knife of RMTs.
That's right. And so from my understanding, that means that he has had a lot of experience in a variety of different conditions, but he's also added a lot of tools to his toolbox. So he's able to treat many different types of conditions with different sorts of techniques. Is that right, Ryan?
Yeah, absolutely. Yep.
Okay, awesome. So again, we're very lucky to have him here today, and he's going to be talking about a condition and several areas of injury that are quite common. And it's something that's been one of the hot topics of the week. So a lot of people signed up for this one, and a lot of people are really curious about this one. So before I let him, go ahead with that, I just wanted to mention quickly that if you do have any questions or any sort of comments that you'd like to post, you can post that in the Q&A box right at the top, or you can post that into the chat as well. And we'll be answering all those questions towards the end of the presentation. If there's anything that, you need an immediate answer to, or maybe you're able to, or maybe you forget and you need it after, you can always contact us via email, text, or even call us as well. So, but without further ado, I'm going to introduce Ryan, and here we go.
Hello, everybody. Thank you so much for joining us on this kind of gloomy Friday from the isolation of your own home. My name is Ryan Plumpton. I'm an RMT here at CorthaCare, and we'll be talking kind of broadly today about posture. What is it? What do we do about it? Why do we care about it? And it's something that's topical, considering that many of us have been working virtually and remotely in a time that maybe we weren't before. So yeah, here we are. A bit more specifically, I'm going to focus on what I call T-Rex posture, which is kind of my pantomime of the worst possible posture you could possibly adopt when you're working on a computer. This is my absolute favorite image from the internet, so much so that I bought the t-shirt. In any case, yeah, on with it. So start just with what is posture. This is a definition I grabbed from Merriam-Webster online. So it is the position or bearing of the body, whether characteristic or assumed for a special purpose, or similarly, the pose of a model or artistic figure. More particular to what we're going to be talking about is the state or condition at a time, especially with respect to capability in particular circumstances. So that might be what you look like during the performance of a sport or an activity. It could be the posture that you're in while you're working at home or working on anything in general. And then thirdly, kind of beyond the scope of what we're going to be talking about today, but we do learn posture. And so the third definition there, a conscious mental or outward behavioral attitude, is also applicable because we do learn how to be in particular postures.
Who here feels like they have a T-Rex posture right now from working from home? You can type yes in the chat box, or T-Rex in the chat box.
This is me working at the office. It's why it's better that I'm an RMT and not a clerical worker. So a bit more clinically, what are we looking at there? So T-Rex posture, so to speak, is a combination of upper cross syndrome and then kind of a flexor dominant brachial or arm positioning. So you can see there that we're kind of really hunched over, heads way forward, arms, wrist, elbow, shoulder, all really kind of curled in and tight. The T-Rex, though a formidable competitor, had terrible balance and really short arms. So that's what you're seeing right there. You may or may not know this about me, but I am a gamer. So though I'm lucky in that I don't spend a whole ton of time in front of a computer during my professional life, I have spent more hours than I am comfortable admitting at that place right there, conquering the world and saving everybody from ne'er-do-wells and villains. You're all very welcome. The ergonomics are questionable but passable, and so that's why it's something I'm very familiar with, despite not having to deal with it professionally too much. So if we can go back 2 slides, please, Manju. What are we looking at here? A bit more specifically, there's a couple things to note. Like I said, you'll notice the head is craned way forward. That elongates the muscles all through the upper back and into the neck. Right at the base of the head where the neck meets the head, it's kind of compressed. It creates a nasty angle in through the suboccipital muscles there. A lot of pressure on the top of the vertebrae. In through the bottom of the neck, you'll see that it's kind of a combination of crunched in right by the clavicle and then elongated all through the front of the neck. We go through the shoulders, they're really kind of squished in and forward. The biceps very contracted, wrists at a terrible angle, fingers not looking very claw-like. So there's a combination of lengthening and shortening that's happening in different positions here that make for it to be kind of a nasty posture. So where might I see this? Anybody who's been working from home or who works clerically in general will be familiar with this from either themselves or coworkers. In addition to that, you'll see it in any forward-facing massage profession, though. So massage, for example, I see my clients in front of me. I'm looking down. My arms are extended out in front of me. So again, I am concentrated forward and central with a tendency to kind of tilt forward. And so it's something you might see from massage as well. Professional musicians also very, very vulnerable to this. Imagine a violin player, they've got their head crunched up, arm out like this, right? So you'll see a variation on it like that. Professional arm wrestlers also very, dedicated to curling in. Everything kind of centralizes. So, everybody would be in that kind of, those kind of professions would be guilty of this to varying degrees and in slightly different ways.
How many of you have found that you have maybe an increase in headaches or increase in shoulder pain or neck pain since you've been working from home? We've seen a lot of patients that have called in for that. If you have any of those or it's gotten worse, type it into the chat box as well. Just type in yes, worse.
So where won't I see this? It's a position that we're not all guilty of. So anybody who has a variety of motion or works overhead, so painters and electricians, right? Big, wide surfaces, arms often up and out to the side. That's going to help to bring them out of that T-Rex posture. Trapeze artists, anybody that works in kind of an athletic capacity will have a much bigger range of motion. Cashiers, standing, not sitting, arms moving side to side, they won't be guilty of this particular posture. They get other kind of fun dysfunctions, but not this particular one. So why is this a problem, right? We've all been told that you have to watch your posture. That is something we need to be concerned about, but maybe have never been explained why that is. When we extend our head forward the way you saw on that Ryan Plumpton T-Rex, there's a couple of things that happen. Technically speaking, it increases the torque on the muscles that actually carry our head. Our head weighs about 10 pounds, kind of on a standard person. Mostly that weight is carried by the ligaments and the bones of the vertebrae themselves. The further forward our head goes, the less those structures are able to actually carry the weight of our head. And so the harder it is for the muscles to do the work just in general. And then through torque itself, it becomes exponentially more difficult. If you wish, there's an experiment you can perform very, very quickly with any object you have easily at hand. If you start first by carrying it kind of close into your chest, you'll notice how much it weighs. If you extend your arm all the way out as far as you possibly can, even if it's a light object, you'll notice that the difficulty in carrying it increases the further away from your body it gets. This is true also of the neck and of the head. So the worse our posture gets, the heavier our head becomes and the more dysfunctional it can cause us to be. In addition to that, any of the muscles that are lengthened for prolonged periods of time are prone to becoming inhibited or hypotonic, as we call them. This can cause a couple of different things depending on how long you're there. If they're long, over years, they can become overstretched or over-lengthened, which is problematic on its own. They can become weak just from lack of activity. And further to that, it can be difficult to kind of resume a more normal or ideal posture if that carries on for length of time. On the other hand, chronic shortness, right? We were all curled in and crunched. Those muscles become short. The shorter a muscle is over a length of time, it can lead to adhesion, which I'll talk about in just a second. Beyond that, it can cause lack of flexibility, poor range of motion generally as well. So what is an adhesion? Take a pardon. Adhesion is a patch within or between structures of the body that has received fascial reinforcement, but that is limiting in some way, shape, or form. So fascia is a reinforcing structure throughout, or a substance throughout the body. It's good, we need it, it helps keep us strong, but like anything else, it can become kind of improperly set up as well. A good way of thinking about it is that there's these little wet spaghetti strings that are always floating throughout our body. When we're stationary, like wet spaghetti that's sticky, it sticks on to the structures that it comes into contact with. Not a problem necessarily, and it can help to reinforce a position that we're in often so that we are more easily able to carry ourselves in that posture. But if you had to come out of that posture, right, we're kind of working away, 6-8 hours a day, you have to come out of it, not a big deal one day. Next day later, it's a little bit harder. You really got to kind of give on it. Imagine tearing apart a single piece of wet spaghetti. Effortless, no big deal. Now imagine trying to tear apart 10,000 pieces of wet spaghetti all at the same time. You're really going to have to work on it. And so the way fascia adapts in the body is kind of in that fashion. It slowly accumulates over time in the intent to reinforce, but if the posture that we're in is less than ideal, then it's reinforcing a less than ideal posture. So how do we get rid of it? Movement is the answer, simply speaking. The more you're able to come out of a posture, whether it be the T-Rex posture or any other, the better time and easier time you're going to have resuming normal or bettering function. There's a couple things you can do. Consider using Manju's 20-20-20 rule from earlier this week. That is to say, every 20 minutes, if possible, take 20 seconds away from your workstation at a distance of 20 feet or greater. This is going to let both body and mind take a break from whatever it is you're engaged with. Unfortunately, sometimes that's not realistic. If you're working on a big project, if you have just a ton of work that you need to get done, you're there, say 12, 14 hours in a day, then your guideline is going to be somewhat different, right? You haven't been able to take those breaks throughout the day. So a way of conceptualizing that is just to remember that the amount of effort it will take to unwind whatever posture you've been in will need to be roughly equal to the amount of time or effort that you put into getting there, right? So if you were at your computer for 14 hours a day, then a 20-second break will not be sufficient to try and unwind, some of the stuff that's crept up during that amount of time. And likewise, if you're only at the computer for 20 minutes, you probably don't need to do a 2-hour workout in order to unwind that particular piece of posture. So static versus dynamic posture. Static posture is kind of a snapshot in time, right? The picture you saw of me craned over the computer, that is the snapshot. That was my posture in that instant. That was a static posture. Dynamic posture is what we look like during the performance of any action or activity. So you can think of that as what an athlete looks like during sport. Anybody who is laboring as they work out during, their labor, chopping wood or whatever else you choose to do. There will be postures that you are in throughout that. Each one is independent from the other, but they do influence each other, right? Imagine your T-Rex doing jumping jacks. It would look kind of ridiculous, right? You kind of squat and do something like this. Over time, if that T-Rex continued to go through that motion, you might find that they unwind and they're able to do progressively, more fluid arm motions, right? So though each one does influence the other, they are independent, and we do want to kind of keep in mind that both do exist. So what does posture lead to? Dysfunction from the T-Rex posture included many things, but primarily headache, trigger points in muscle tonicity, hypertonicity, or tightness. TOS is thoracic outlet syndrome, carpal tunnel or double crush, which is something that Rebecca talked about earlier in the week. We can get impingement of both the glenohumeral, which is the shoulder joint, or the nerve pathways, kind of anywhere down through the arm. Frozen shoulder is exactly what it sounds like. It's basically the inability to move the shoulder through adhesive capsulitis. Facet joint irritation are part of the vertebrae all throughout your back, and they can become irritated if there's too much stress put upon them. So remember that torque. We can get then generally just decreased range of motion, poor muscular strength, and a host of other things. So my treatment philosophy. Of the above impairments, I tend to focus on range of motion as my preferred diagnostic. The reason I do that is that it's kind of a good catch-all. It tells us a lot about what is happening. If there is a single element that is limiting the range of motion, everything else can be healthy, but that one thing will still stop you from, say, reaching above your head. If we can isolate that one thing that is causing that issue and remove it, then the range of motion returns. And likewise, if there's a whole host of symptoms, or a whole host of things that are causing limited range of motion, then we can triage them, right? So say you come to me and you say, Ryan, I can't put my arm above my head. It's like, okay, well, let's figure out what it is that's stopping that, right? There will be a list of things. We get rid of the one that is most bothersome, and then maybe we get from being able to get to here, 15% better, say something like that. Well, that's a win, right? But it's not the whole kit and caboodle. So then we reassess after that, and there's something that is next most limiting. We treat that, it gets better. Now we're able to go to here, 40% better. You follow that train long enough, and you can, in time, retrieve full range of motion. On the flip side, just because you have good range of motion is not an endorsement to abuse your body. I can speak for myself. I'm lucky, again, through my profession that I demonstrate stretches all day long, so my range of motion has been preserved. But during this time of kind of cloistering at home, I've spent many hours in front of that battle station, and I've gotten some pretty wicked headaches. A reminder to myself that though my range of motion is good, there is a price to be paid for being heroic. Mm-hmm. So now, the reason you're all listening to my voice, what do we do about this, right? What is it that we can do to prevent or maintain our health? So there's two main things to be kind of cognizant of as we're going through this. We need to stretch the short things. Remember, that posture has us kind of crunched up in a variety of spots. So we need to stretch the short things, and then we need to strengthen the long things. It doesn't even need to be a prescriptive stretch per se, right? You can do this on your own just by kind of scanning your body throughout the day. If you notice you've been in kind of a weird twisted position, how do you come out of that and say you're twisting and you're like, oh, that's okay. Oh, that needs some work. So then we try and stretch that out. For myself, if we're doing, the thing we all did in kindergarten where we're bobbing our head, You know, I'm tight right there. I can feel that. The rest of it was okay. That's the spot that needs some work. And so you can scan yourself throughout your day and actually isolate the spots that need more attention versus the other ones, right? On the flip side, any of the places that have been long, right, through the mid and the lower traps in particular from that upper cross syndrome, we need to strengthen those. That's going to do a couple things just passively. The stronger a muscle is, the better it's able to naturally maintain its posture, which is to say it will pull a little bit more than it otherwise would in a weakened state. So the more healthy the muscle is, the more fit it is, the better you will maintain your posture just without spending any time or attention on it at all. So now, having said that, we're going to go through a couple of prescriptive stretches and exercises. We'll start with some stretches. This one is not a stretch per se, but kind of a positional check. So in the first picture on the left, you'll see that's kind of a standard neutral sitting posture. In order to get a stretch out of the suboccipitals, which are those muscles that run right along the base of the head, you need to do a chin tuck. So pretend as though you're closing a drawer with your head. So you're trying to pull that back. Your chin comes out the back of your neck, and you give yourself a double chin, as you can see right there. It's a position you can hold 5-7 seconds at a time. There's no real length that you need to hold it. After you do this, it's a good reminder to your body in general, but your neck in particular, where you're just like, oh, right, we don't want to be carrying 10 pounds of weight purely through the energy of our muscles. Let's let the vertebrae and the ligaments do a bit of a better job.
Not going to look pretty, but it's okay. You're at home, so you're allowed.
Yeah, that's right. So now a couple of actual stretches. For any stretch, there's a couple of guidelines. To increase the length of a muscle, it does look, all of our data suggests it takes a minimum of 30 seconds to do so. So for all these stretches, please do hold them for at least that long. There is some indication that up to a minute being held is going to increase the benefit. So if you're feeling ambitious, feel free to hold it for even longer. This is the SCM stretch. So the SCM is a muscle that runs from the base of the ear in through the front of the collarbone. To stretch it, you're going to do a couple things. Start by tilting your head sideways. Then you're going to look up, and then you rotate your ear away from that side. So it's kind of a three-part motion, and you'll feel that stretch all in through the front of the neck there. Please do both sides for everything as well. Good. These are the scalenes. It's a group of muscle that run more in through the side of the neck, and then down and through the front of the ribs. There's a couple things I want to point out here that might not be immediately obvious. You'll see I'm holding the side of the chair there, or the stool, sorry, in that picture. That helps to keep the shoulder depressed. Otherwise, as you bring in your head sideways, it's going to try and kind of crank up on you like that. So hang on to the side of whatever you're sitting on to make sure your shoulder stays put, and then trying to just tilt the head, not rotate it. So I'm not doing this. Instead, I want to do this. And you'll feel that stretch all in through the side of your neck here. Perfect. This is a stretch for the Pec Major. So there's two main muscles in through the front of the chest. There's the Pec Major and the Pec Minor. This is the bigger of the two, the Pec Major. So you find, my preferred stretch is this in a doorway. So you find any 90-degree angle that will work. So if you happen to be at the gym, say you could use a post or a pole if that's available to you. At home, a doorway works great. So I've got my arm anchored there on the elbow. So you're not actually having to hang on to it with your arm or anything. Just having your elbow kind of anchored on the side of the door frame should do that for you. Line yourself up nice and straight. You'll notice my back foot is in line with the doorway. And then you take a big step through the door with the same leg as the same arm. And as that happens, the arm comes from central out to here, and you feel a stretch all in through the front of the chest right like that. This is the Pec Minor, which is the counterpart to the other one. It's almost the same motion, but there's a couple of differences. You're going to line yourself up in the same fashion as with the Pec Major, but instead of having your arm out at 90 degrees the way you did, you want your elbow up as high as you can possibly get it. And then it's exactly the same motion. Again, step through the doorway, and you'll feel that stretch a bit more through the front of the shoulder, and this one runs a bit more through the side of the ribs almost. One more the other way, sorry, Manju. Yeah, perfect. This is the bicep, so it's the main muscle in the front of the arm. Not the only one, but the main one. What I've done here is, again, I'm anchoring on the front of my wrist. I'm not actually hanging on with anything because that's too much to concentrate on. So you anchor at the front of the wrist, you extend your arm out straight, and then this is the only tricky thing about this is you actually have to rotate the front of your elbow so that it's kind of pointed forward, right? I don't want my elbow up like this. I actually want the elbow forward facing. and then you rotate both shoulder and chest away, extending out, and you'll feel a stretch all through the front of your arm right there. The forearm flexors, this is a bit of a review for anybody that watched Rebecca's presentation earlier in the week, but they are the muscles just to the front of the forearm here. This one's super simple. The only thing you want to remember is that you're not just grabbing the fingers, you're actually grabbing the closest row of knuckles as well. So you're grabbing both portions with your other hand and then bringing them up to as close to a 90 degree as you can, right like that. If you want, you can also do it downwards like this, if you prefer. No difference as far as I'm concerned. So this is a somewhat tricky stretch that you might not be able to feel right away depending on how tight these muscles are. This is going to be, these muscles turn the hand over like that. So in order to unwind that, you actually have to turn it back this way. So my preference is to lean my elbow on my knee, as you can see there. Then you're grabbing the meat of your thumb with your other hand kind of wrapping around like that and pulling the thumb towards the floor. If you have any questions about this one or any of the other ones, please do send a message and I'll be happy to kind of elaborate further. This is probably the hardest one to get the handle on, but if it's tight, you will feel it pretty quickly, so you'll know. So the two main things that we need to work on strengthening in order to kind of unwind that T-Rex posture are the deep neck flexors, which are the ones right at the front of the neck right here. Remember, they were really stretched out when we got into that kind of chicken-headed posture. So we want to be able to make sure that we can pull our head back like so. And then the other ones will be for the back itself. This one is just isometric, which is to say stationary. You don't need any implements or anything like that. You loosely clasp your fingers around the back of your head, as you can see, kind of right like that. Then you're just going to pull your head back into your hands and meet that resistance with your hands. This is not a struggle to end all struggles. You're using, say, 20-25% of the force of your neck, and you just pull back into the hands and meet the resistance. Hold for 8 to 10 seconds at a time and repeat 3 or 4 repetitions. Once you're comfortable with that, if you want, you can turn up the ante a bit and use a bit more force, meet that resistance a bit more strongly, and develop your strength in that fashion. But to start with, you're really just looking, 20-25% of your force, pull your head straight back into your hands and meet that resistance with your arms.
Is there a routine that patients or people who have this posture should follow? Should they do stretching for the first week or first 2 weeks before they start strengthening, or can they do both side by side?
Yeah, you can absolutely do both side by side. It would be preferable, actually, because then you're tackling the problem from both sides, not just one or the other. With either stretches or strengthening, it's really important that if you are experiencing kind of acute or intensified pain during the performance of the activity, whether it's a stretch or an exercise, you stop. And then you talk to your healthcare provider, whether it be myself, Cairo, your family doctor. Do not continue if you're experiencing acute pain during the performance of the activity. But I don't expect any of these should give anybody any difficulty. And then, so this is my all-time favorite exercise for kind of the mid and upper back. It's called the reverse fly. It is a humbling exercise. You will have very, very strong individuals look not so strong when they're performing this exercise correctly. It takes advantage of that torque, actually. So see, the first position on the left there, I've actually got my chest rested on my knees, so I'm actually not having to worry about supporting my torso at all. The arms are straight down to the floor. The weights you should be able to comfortably grab with your hands. And then you're bringing your arms straight out to make a T, kind of right like so. The second image doesn't quite let you see it, but you do want to come straight up and out. You don't want to have the angle of your shoulder break. And what I mean by that is, I come out to 90 degrees here. My arms aren't down like this at a broken angle. They're right up to make a T as much as I can. The very last portion of this, you pretend as though you're trying to squeeze a pencil between your shoulder blades. You can see in the very center of that right image, there's a bit of a divot right over top of my spine. I'm actually actively squeezing my shoulder blades back and together at the very end of that exercise. And that's going to really help pull the shoulders back and kind of down a bit and strengthen those muscles of the middle and lower back, which will help to unwind that T-Rex posture.
Any questions, you can type them in the Q&A.
So other considerations about posture. Office and home ergonomics is an important one. If your setup is really bad, if you're having to crane your neck sideways to look at your computer screen, that's going to cause other problems. If your wrist is having to rest on a sharp angle while you're either using the keyboard or mouse, that's going to cause some nastiness as well. Resting on a surface can lead to compression. Compression can lead to adhesion or carpal tunnel, depending on where it is. which is obviously not something we want to have happen. Strength and balance is obviously not great. One of my most longtime clients when I was working in Toronto was a very, very fit individual. And we were having a hard time kind of figuring out what is going on. Why is this guy always in pain? He was getting wicked headaches, huge amounts of tensions to the upper back and neck. Until one day I just was kind of asking him, what does your workout look like? And he said, oh, I do a ton of chest work and a little bit of back work. And I said, okay, well, what do you mean by that? And he said, well, you know, I bench press, and I don't remember what it was, but some absurd amount of weight. But he was doing a lat pull down, which is a comparable sort of difficulty exercise at about a third of the weight. So we had identified a huge strength imbalance between the front of the chest and the back. And so if you imagine those muscles being in a tug of war, his back was losing 24 hours a day, 7 days a week. No wonder his muscles were grouchy, right? So strength imbalance, even amongst a very fit individual, can cause symptoms like headache, muscle tone, a lot of that other stuff. That image is pulled from a movie called Lady in the Water. It was an M. Night Shyamalan movie that was pretty good, I thought. But this scene is kind of funny because he's been working out, calling himself the science experiment for years and years and years, and all of a sudden there's a very contrived situation where you need one very strong arm, which in this case is the right one there. Hydration throughout the day is going to influence your overall health, so please be mindful of the amount of water you're drinking, even at home, right? It's easy to get sucked into what we're doing and not remember to drink enough water, and that will have an influence on your fascia generally, which can lead to things regarding posture. And then my personal strategy is just to build as much movement as possible into your day. I'm guilty of being lazy sometimes, but I do try and walk to and from work. You know, that's just a little bit of movement that I've built into my day. I'm fortunate through my professional life that I have movement built in that way. It will be a different strategy for each of us, right? But the more you can do to ensure that you're not having to actively go through exercise and that it's just kind of there already, the better success you're likely to have because you're not having to think about it. It's one less thing on your mind. So that is the end of my presentation. So thank you so much for joining us. If you do have to take away one thing, it is that movement is the cure. Positional dysfunction is somewhat difficult to resolve after it's presented, very easy to prevent. The more you can get up, unwind whatever posture you've been in, whether it's the T-Rex posture or any other, the easier it will be for all of us in the long run. As I play at being a T-Rex with my kids all the time, and I can tell you it's a boatload of fun, but I would not want to have to live like one.
Thanks, Ryan.
Thank you. If you do have any questions, please do put them into the chat and I'd be happy to answer them now.
So thank you again for that. We're closing off our webinar week with Ryan and talking about T-Rex posture, and definitely a lot of good tips. I know a lot of you have been requesting those, and it's something that is your go-to. So you can definitely print those out, kind of, once we send you the presentation, and maybe keep it at your desk. Sometimes people keep it on a board, in their office, or even just on their nightstand, just so as it's sort of like a reminder to do those stretches here and there, and maybe not just when it's painful, but just sort of incorporate it into your day-to-day routine. So if you do have any questions, just like Ryan said, you can email us, you can message us on our website, or you can even call us. And we do miss our patients dearly, and we are sad that we were not able to go back as of what they had said yesterday. We're not part of the stage 1, but we're hoping in the next few weeks we're back up and running. That being said, we are taking urgent care appointments for chiro and physio right now. Whether a new patient or a current patient, we're able to do that. And if you're not urgent care, so your pain is not severe, but you do need some assistance with, stretches or a new area of concern, and you don't necessarily want to come to the clinic, we can do a virtual assessment. We can do a virtual treatment as well. And we've done quite a number, and it's been quite successful. In fact, I would argue that it's probably a good time to do it now versus after, just so, because you're not really doing those activities that often are causing the pain. So definitely something to think about. So we're closing off the webinar week. If you have any questions, if you have any comments, suggestions about the week, or something that you really enjoyed, or something that you want to hear more about, again, shoot us an email, text, call us. We appreciate all the feedback. Thank you again, Ryan.
Of course.
And I hope everybody has a great weekend. And again, thank you for joining us today.